Hello and welcome to Maidstone Hospital. My name is Mr. Day. I'm one of the consultant ophthalmologists here. We have 15 consultants here at Maidstone Tunbridge Wells, which makes us the largest eye department in South East England, serving a population of 1 million. We have up to 6 specialist trainees from the KSS Deanery and also 2 FY2s on 4 monthly placements. The ST1 usually stays for a couple of years. We have then a collection of ST4s and ST5s. We currently have a TSc in ocular plastics, and there are plans to expand the fellowship program to include other subspecialities. With regard to clinical experience, we have consultant-led speciality clinics in all branches of ophthalmology. The casualty is also by appointment basis, and we have 2 dedicated A&E consultants. So the sessions by the trainees are well supported, well supervised, and it's very useful if there are complex cases that they can seek an opinion very readily. Due to the variety of subspecialities available here at Maidstone, trainees are able to address their clinical and surgical deficiency before they come here. It also provides an excellent foundation for junior trainees also. All the consultants are very keen to teach, and they're all involved in various aspects of training, give it clinically within the outpatients department or surgically in theatre. We also have the latest eye simulator, the IC, which is currently in the academic centre, so juniors can easily practice the skills that they have learned in theatre. Research is very strong here at Maidstone. We have multiple multi-centre trials occurring. Trainees are often encouraged to get involved in these trials to contribute. With regards to audit, we expect most trainees to at least undertake 1 audit during their time. We have an excellent audit department which are able to collect data and analyse your data, and once the audit is complete, they also provide you a certificate which you can load onto your e-portfolio and use as evidence for your ARCPs. In conclusion, we're a happy and friendly unit with a good rapport with nursing, management and the trainees, and some trainees even return back as consultants like me. Okay, come and meet our trainees and I'll show you around the department.
So this is the tea bar. You can always grab a quick snack in between a busy clinic from here. We accept patients by referral only, so no walk-ins, and this is where they book in when they come, rapid access desk. So I'm just going to take you through the rapid access rooms now. So if you follow me through, we've got 2 vision channels here where patients get their vision checked by an HCA or a nurse here. So this is the rapid access triage office where all the patients get booked up in the clinics. We have 4 rapid access rooms, and multiple doctors are doing eye casualty at the same time. If you need any guidelines, this is where you find them. And in this filing cabinet, we've got everything that you might need during your eye casualty sessions. This is where the staff room is located, and you can always grab a cup of tea during your clinical sessions from here. So straight over from the staff room, we've got our eye emergency treatment room. So if you need to do any procedures during eye casualty, this is where you do them, and you can do any subconjunctival injections, or people can draw bloods for you in this room. This is where our visual field rooms are found, and you can take any patients you need for any emergency visual field test through here. So we've got orthoptics cover 5 days a week. Now I'm just going to hand you over to Ali, who's going to take you through the main clinic.
So my name's Ali, I'm a ST5 in ophthalmology here. I've been here for 7 months and I'm going to show you around the outpatient department, which is where all of the main clinics on a day-to-day basis happen. So come with me. This is the main staff entrance for the outpatient department. We've got 9 rooms down here. I'm going to show you more. Through here we've got all of our equipment, pachymeter, we've got a corneal topography machine, autorefractor and some phasemeters as well. So we've got really well equipped rooms, slit lamps and Snellen charts in every room. And this is the main hub area here where you can get all of your surgical listing sheets, continuation sheets, TIA referral forms and everything else from here. We've got our equipment here, Ishihara books, X-ophthalmeters, all positioned here in the central hub, accessible for everyone. So down here is where the consultants tend to sit at the end. These are the big rooms. I'm going to show you the waiting area through here. So this is one of the waiting areas. Patients sit here and then they come through into clinic. And back there we've got our research office. The department has an active research unit with lots of trials going on all the time. So another waiting area here where patients wait and then go through to this side. And back here we have an office where our ECLO sits and she can provide assistance for all of our patients who need low visual aid support. And if we go through to here, I'm going to hand you over to Camille. She's the ST2 here at the moment.
Thanks, Sally. So I'm Camille, the current ST2. I'm just going to show you around Davis Clinic. So this is where we do all our fancy imaging for retinal imaging. And we've got an Optos machine there, fluorescein angiography, and an OCT scanner. And we've got a fantastic team of technicians as well. All right, so moving on to the minor ops room. So we've got 2 of them here. And this is where we do all our intravitreal injections and we do our minor op procedures like eyelid lesions, excisions. We will keep our endophthalmitis packs here. And then we've got all our equipment that you could possibly need for surgical procedures. So forceps and needles and everything just here. I'm just going to show you around the Davis Clinic. And this is where all the medical retinal and vitreoretinal clinics happen. So this is just a typical room. You will find all indirect ophthalmoscopes in each room. And all the computers are networked with the OCT machines. Also, we've got lots of lasers. So this is the argon laser in this room. This is where we do our YAG lasers. And this room we use for photodynamic therapy.
Okay, I'm now going to introduce you to Maria, our current ST5, and she will go through the theatre section of the induction.
Hello, I'm one of the senior trainees, Maria. I'll take you through to my favourite part of the eye clinic. So this is the all-important on-call room, furnished with a lovely bed, a desk, a chair and a cupboard and of course the ensuite. So useful at 2 AM in the morning. Right, so now we're going to get scrubbed up for theatres. So welcome to theatres. This is Janie's office, our head sister. And come through around here and I'll show you the theatres. All important badge on. So this is Theatre 2 and this is where the patients come in. That's where we do our subtenons and topical anaesthesia before they then go on into theatres. So this is where we recover our GA patients, just down here. And this is the nurse's desk, and then all the beds where the patients stay. And then moving around the corner, we're going to go to the coffee room now. As you go in, there are always lists up of what's happening in theatres that day, so morning and afternoon. And then all the coffee and tea facilities around this corner. And lots of chairs, places to leave your bags, etc., and then the filming of the theatres. So welcome to theatres. This is a state-of-the-art theatre with our GA machine here and our microscope that is ceiling mounted and our Stellaris micro-incisional cataract surgery machine. I'll take you through now to where the lens bank is. So the nurses come round here and collect the lenses, and we have all the usual sizes of lenses and different types of in the bag and sulcus lenses. And then just to the other side is Theatre 2, so we were in Theatre 1 and now we have Theatre 2. And then back towards eye day care now. So we have some rooms where we examine the patients pre-operatively, and then some chairs where they sit. Our nurses stay here at the nurses station, the place where coffee is prepared. And then before cataract surgery, all patients have to have their biometry checked, and they come here for those measurements to be done on the eyes.
Okay, this is the entrance to the eye day unit, and I'm going to take you through to the secretary's offices. So this is the planned care office, and basically all the cataract surgeries, all the procedures are all listed and organised in this office here. So if there are any emergency cases that you need to book, you need to inform one of the members here in this office. Okay, so just down from the planned care office is my secretary's office, and here's Vicky, my long-suffering secretary, and she's going to be talking to you about how to dictate your letters properly.
Hello, I'm Vicky Lee and I'm Mr Day's secretary, and today I'm going to explain how we would like our secretaries the letters to be typed. At the beginning, please state clearly who you are and the date of the clinic, the patient's name and the patient's number. Make the letters compact and to the point, no waffling. And when you've finished with your dictaphone, please don't let it run, because you'll be surprised what we can hear and how long it can run on for and what we can pick up. We don't have notes, we just have e-notes, so it's important to put the facts in the letter so as that you and the consultants can read back to the letter and realise what the history is.
We have a regular teaching programme on Friday afternoons, which is well attended by the consultants and all other grades. Trainees regularly present interesting cases, journal clubs. Sessions are also interactive, which enriches the learning experience and also provides valuable feedback to the trainees themselves. Feedback from trainees have been extremely positive. Most trainees felt that the time that they spent here at Maidstone, they're able to feel confident to progress on to the next stage of their ophthalmic training.
Hi, I'm Kim Sullivan. I'm the Head of Service for Head and Neck. I form part of the management team in the Head and Neck offices, which are based next door to the theatres. The colleagues that I work with are Andrew Esling, who is the Assistant General Manager for Head and Neck, and Anita Wyborn, who is the Business Manager for Ophthalmology. You'll get to know Anita very well because she'll be your first point of contact for everything from leave, rotas, and any concerns that you have.
So the SD2 is in charge of the on-call rota, and it's currently a web-based one, so you can arrange your swaps and do all the amendments online. It's quite important to know that you need to give at least 6 weeks notice if you're planning to take any annual leave or study leave. And also the department is quite flexible. If you're sitting any exam, they can give you 5 days of study leave as well. So every doctor has got a designated pigeonhole, and this is where you'll find all your letters or correspondence, and you need to make sure you're up to date with that so that the letters can go to the patients quickly and safely.